I'm Dr. Stephen Goldstein. I'm a professor of obstetrics and gynecology here at the NYU School of Medicine, NYU Langone Medical Center here in New York City. This is another segment in our series, Reducing the Confusion in Gynecology. And the thing I want to talk about is the fact that intercourse in menopause doesn't have to be painful. This is absolutely shameful. Other primates, chimpanzees, gorillas, they survive a year or two after they stop reproducing. Today, women who are 50 years old and don't already have cancer or heart disease have a life expectancy of 91. Women are spending 40% and more of their lives in a menopausal state. Menopause is defined as when you no longer have ovarian function. You no longer make estrogen. Many of you are aware that the hot flashes, the night sweats, but they tend to get better. About 80% of women 4 to 5 years into menopause will no longer have symptoms, although some women have symptoms indefinitely. But the lack of estrogen in the vagina causes atrophic changes that just get worse and worse and worse over time. And these can make attempts at sexual intimacy extremely painful. And it's sad to realize that there have been studies recently that as many as 50% of women think this is just the way it has to be. They're unaware that there's any treatment. Only 7% of healthcare providers had even initiated a conversation about intercourse after menopause, and only 11% of women who were having difficulty were on some sort of medical treatment for it. There are a number of very safe products. There are estrogen creams, tablets, rings that go into the vagina in incredibly low doses. One of the estrogen preparations is 1/300th the dose we give orally for hot flashes or night sweats. And yet the FDA still believes in what's called class labeling. They will give a label to these products that talks about blood clots, dementia, breast cancer, which is totally unfair. When I was past president of the North American Menopause Society, we wrote an editorial, we went to the FDA, we petitioned them to please remove these draconic warnings about these low-dose vaginal estrogens. And yet that was 2 years ago, and they have taken no action. And this has caused many women to be fearful, many women to suffer in silence. Such products, when used appropriately, are not absorbed into the bloodstream, do not cause any increased risk. In fact, many women who even have had breast cancer have oncologists who allow them to use these local vaginal estrogens. In addition, there are some non-estrogen products. There's the SERM. SERM is SERM, selective estrogen receptor modulators. There's one SERM called Osphena that's taken orally that treats the vagina. And now there's a drug called Intrarosa, which is DHEA sulfate, which is put into the vagina, although it's every night, 7 days a week, 365 days a year, which also helps to restore some of the normalcy to the vagina, to put back some of the normal pH, some of the normal elasticity. And so if you are menopausal, if you have a relative or friend, neighbor, colleague who's menopausal, it seems to be a sensitive subject, but it is coming out of the closet. They're beginning to advertise on TV. They did it for men. They changed impotence to erectile dysfunction, vaginal atrophy, and the pain of intercourse and sexual intimacy in menopause doesn't have to be. So talk to your doctor or talk to us, but we can help you.